Overall, 4,718 individuals have been tested for COVID-19, and of those tested, 644 tests are pending. I will now share the most current case counts. There are 40,190 confirmed cases of COVID-19 in Canada and 12,245 cases in Ontario. Chatham-Kent has 37 cases, and Sarnia-Lambton has reported 159 cases. Michigan now has 33,966 cases, with 8,026 cases in Detroit. Today, we are reporting 525 cases of COVID-19 in our community, an increase of 7 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both staff and residents. 116 cases have recovered. 26 people remain in hospital. 18% are between the ages of 50 and 59 years, and 23% of our cases are 80 years and older. 39% are male, and 60% are female, and 1% are unknown at this time. Our community has lost a total of 31 people to COVID. 22 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. This includes healthcare workers, caregivers, care providers, and first responders. Residents in the community referred for testing by the health unit and another primary care provider will also be tested. Testing will be completed on all residents and staff in long-term care facilities and retirement homes. Working with our EMS partners and other healthcare partners, assessment and testing will continue in these facilities. Please continue to visit wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. You have probably heard us talk about contact tracing a number of times over the recent weeks. Sometimes we forget that while this might be a common term to us, it is not something that everyone talks about regularly. To answer your question, I'll try to explain today what contact tracing means. Contact tracing is a critical tool for public health to control the spread of any communicable disease. Contact tracing and contact management is the most important measure to limit the spread of COVID-19 in our community. Contact tracing requires a specialized training and skills. We can call these public health nurses that are specialized in contact tracing as disease detectives. Generally speaking, contact tracing is the process of identifying people who have come into contact with an infected person, also referred to as a case. By tracing contacts of an infected individual, monitoring them for their symptoms, providing counseling and support, and testing them for COVID-19 if they become ill, the goal of public health is to reduce additional infection in the community. Even when we have a good treatment available, and right now we know that there is no treatment available for COVID-19, without appropriate public health case management and contact tracing, COVID-19 will spread in the community like wildfire. When a person is confirmed as a positive case for COVID-19, public health staff contact them to inform them of their diagnosis. During this conversation, public health staff conduct a detailed interview with the case to collect information about their symptoms, their physical health risk, and social risks. This interview also includes asking questions about people and who they were in contact with 48 hours before they start to show symptoms of COVID-19. Not everyone that has been in contact with an infected in case of COVID-19 is at a high risk of contracting disease or further spreading the virus. Only those determined to be in close contact with the infected individual will be advised to take action to limit potential exposure to the rest of the community. Close contacts include people who provide direct care to the person or to the case, have had close physical contact with the person, which is more than 15 minutes, or live with that person, live at the same house with that person. Please note, not all close contact will contract COVID-19, so don't panic. If you are identified as a close contact for COVID-19, just follow the public health recommendations to self-isolate and monitor your symptoms. When these contacts are appropriately self-isolating, they will not come in contact with anyone else. They can potentially stop the spread even if they develop COVID-19. Contacts are broken down into household contacts, that is people who live in the same house with the person, and close contacts, those that the individual interacted but do not live with. With strong physical distancing measures in place, the number of close contacts is likely to be lower than normal, which is important for both management of contacts and the spread of disease. The next steps once contacts are identified is to reach out to them individually. For household contacts, public health staff will ask them to stay in self-isolation for 14 days and will conduct regular health checks on them. For those that are identified as close contact, public health staff will assess if they are symptomatic for COVID-19. Anyone that is a close contact and symptomatic will be referred for testing, and public health staff will provide regular check-in. For contacts that are asymptomatic, they will be asked to self-isolate and contact public health if they develop symptoms or have questions. Once a contact tests positive and they officially become a case, the process of contact tracing starts all over again. To give a sense of what this looks like, we estimate that each individual case of COVID-19 will infect 2 to 3 people, creating 2 to 3 additional cases for follow-up and contact tracing. As an example, one positive case could result in 3 new positive cases, each of which could include an additional 3 positive cases, resulting in 12 new cases for requiring daily monitoring by public health staff. If we consider the 518 or 525 cases today now, we currently have, and the remaining 605 tests that are pending, it represents a minimum of 1,100 people that public health is connecting on a daily basis. Each of these 518 cases on an average have 3 to 5 close contacts each. That means roughly additional 1,500 to 2,000 people or contacts have been contacted by the public health department. Our team connects with all these close contacts to advise at least once. You can imagine how much time they're spending to keep our community safe and limit the spread of COVID-19 in our community. The WECHU, or the Windsor-Essex County Health Unit, has expanded our team of professional staff doing this work to ensure that we are able to contact all the individuals to do a good case and contact management, complete contact tracing, and manage the risk to our community. Through redeployment of our infectious diseases team that has grown from 13 nurses to over 70, responding to questions and following up with all the cases and contacts. as well as we have epidemiologists and other public health staff supporting this very important work in a variety of roles. I hope that this helps to explain contact tracing and assure the public that if you are a contact, public health will get in touch with you, provide you with the direction, and support you through this difficult time. Thank you.
Take questions from the media. We'll start with Blackburn.
Just a quick one. At last, you said you have now 70 staff who are doing this contact tracing? Up from 14, is that what you said?
Usually we have 13 nurses who are working in the infectious disease department, and through rate of deployment measure, at least 70 of them are doing this work, and others are doing the other important work, and they can be pulled to support this work as needed.
Okay. And the number of pending tests continue to rise. Do you have an average of how many test results we get back in a day? Like, are these new tests, or is the number just climbing? Is that the number of tests?
The number of tests are, it's a combination of new tests as well as some of the test results that are getting delayed right now. And the delay is due to several reasons. Obviously, the lab, the logistics of bringing all these samples to the lab and then the lab testing them. There's been an increase in the number of tests throughout the province, and there has been some central delays. The lab is trying to find a solution to provide results quickly, but most of these cases that are actually that are sick, that are in the hospitals, or who requires additional care, their results are getting back within 24 to 48 hours. So that turnaround time is fine. Some of these delays are more on people who may have mild symptoms or who are out in the community. But the lab is actively working on it to get the results faster.
I don't know, you kind of release this every Friday, but like when we say we have 7 new cases a day, what percentage of that of the cases that you received results of yesterday?
We'll try to answer that question tomorrow when we are doing all these details in terms of what the number of testings looks like and the percent positivity of those cases. We'll try to answer that question tomorrow. Yeah, tomorrow. It's can't even track of the day.
Any questions from CTV?
Sticking with the contact tracing, in a border town, how challenging is that, given even with essential workers, we still have people coming and going through the community?
It is challenging, and that's why it takes time. Sometimes it takes a few contact with each of these cases to get all the information that we are looking for. In some cases, as I identified, that you have to be a close contact to be at that high risk. And generally, most people who are coming in close contact with others, we get the information, and that's how we reach out to them. In some cases, in large settings, or in which is not happening at this time, but that is a concern that if we are getting that information for any other reason, for TB, for example, we do contact tracing for TB in migrant farms, in the university and colleges. We reach out to all the students who were in the same room for a certain period of time. So from a border perspective, especially for COVID, I am not aware of that we have come across any unique challenges. The challenges are exactly the same.
Can you go? How far can you go? Can the people tracing go into other municipalities or throughout the province?
Sometimes that does happen. That that we receive what we call as a referral from the other health unit. So a case who went to let's say Toronto, and then they actually stayed there for some time, but had some kind of a contact with our community members. So we get a referral that we found a case that is actually your resident, and then we have a result. you need to maybe initiate the contact tracing process. So then we take that referral and then we do that. So it happens all the time. Sometimes even from other provinces we get that.
I do have another question on a different topic, but I don't know if we want to stick to this and keep going through, or?
Let's go with CBC.
All right.
Any questions from CBC?
Yes, good morning. I was wondering, you had talked about people that were in close contact, and it was physical contact for about 15 minutes. Why is 15 minutes a time and not like 10 or 5 or 20?
So any kind of physical contact, what we are talking about is direct physical contact, that is considered as a close contact. What 15-minute is, if you are in a close proximity, not maintaining the physical distancing piece, but not having a direct physical contact. That's like 15 minutes. So if I'm having a conversation with someone within 1 meter's distance or under 2 meters distance as recommended from a physical distancing piece, any interaction more than 15 minutes should be considered as close contact, because now there's this possibility that you may have come in contact with that person by the time that they're talking to you, or the potential for them to spread it to you. Any direct contact should be considered as close contact.
Gotcha. So why has the health unit decided not to collect data on race, unlike other health units?
Can you repeat your question again?
So why has the health unit decided to not collect data on race, unlike other health units like Toronto?
So, a good question. So when we are doing all that, collecting all that information, it provides us good details with respect to case and contact management. As a data person myself and my team, we would like to collect everything possible. But we have to find the right balance of what information is essential for case and contact management. And when everything starts, you have to go with what is the most critical pieces of information that you need. As a hindsight, yes, we could collect that information, and then it will give us some additional data. If we start to do that right now, would that change? Probably not much. So again, we learn from all these things, and our intention when we are collecting all that information should help us in doing a case and contact management. We can consider that that data in the future, but I don't see any real benefit of case and contact management just because of the race.
Okay, thank you.
Any questions from Windsor?
I'm okay, thanks.
Any questions from AM 800?
I know I checked in on this yesterday, Mike, but has there been any word yet on if Windsor-Essex will be receiving any of the help after the province decided to request military assistance? Will any of the homes in Windsor-Essex be getting any of that help?
So what we have a structure in place through the Ontario Health, and I am participating in those at those decision table as well. Any kind of response that is needed, we are contacting every home that are currently in COVID-19 outbreak. Our team reach out to them, myself and Teresa, our CEO, directly. We stay in touch with them. If not every day, then maybe every other day. We are having those conversations, and those needs are identified. So far, the homes that are in COVID-19 outbreak, we haven't heard or got an indication that they are in that dire need of staffing and support. If that happens, we will escalate it up all the way to the regional table, and then through the province, and to seek assistance. So far, with the support of the hospitals, with the support of other allied healthcare agencies, and through the Ontario Health teams, we are able to meet those needs. And so far, it looks good, but it can change any day. If it changes, if it's needed, we will reach out to everyone possible to get the help that we need.
Okay, thank you.
Any questions from the Windsor Star?
If a Toronto resident is in Windsor and tests positive, does the Windsor-Essex Health Unit count that as a confirmed case for Windsor, or is it Toronto's case?
So if the address on that person health card is a Toronto address, then it goes by, it is counted in Toronto. That's my understanding. But if that individual has close contacts or interacted with our people in our region, we will be doing the contact tracing, and we will do all of that. But anyone who lives in Toronto that this person may have come in contact with, Toronto Public Health will do all that contact tracing.
Okay, and then in terms of giving us all the information about contact tracing today, did you get the sense that the members in the community really weren't understanding their role if they were being reached out to as a close contact, or what really brought this on?
So we received a number of requests and questions and concerns about the community not understanding that some people felt that they were contacts but never contacted, and some felt that everyone should be treated as contacts. So we felt that it is important to try and explain it to the best of our abilities to help people understand what it means to do a contact tracing. I'm not sure if it was clear enough for everyone, but it is a complex job, and that's why these nurses and our public health staff are specially trained to do this. And but that's pretty much bread and butter for public health that we do for managing any infectious disease threat, and that happens all the time. COVID-19 is obviously is a response that is much larger and much bigger than any other infectious disease threats that we have seen in the community. But our team is involved in contact tracing all year long, whether we are talking about pertussis, whether we are talking about TB, or any other infectious diseases.
And then I know Maureen asked this, but I just want to make sure I heard properly. You said it was 13 public health nurses doing these calls, and now it is 17 or 7070?
70.
70.
Yeah.
Okay, thank you.
Any further questions from Blackburn?
No, I'm good, thanks.
CTV?
Going back to long-term care homes, what extra precautions are workers at long-term care homes required to take to prevent bringing the virus back into work?
So the question is what extra precautions that all these workers who in the long-term care homes are following to ensure that they're not introducing COVID-19 in the facility. So through various directives, local recommendations, anyone who is working in the long-term care homes, they are screened before they come to work, including taking daily temperature twice a day before the beginning of the shift, before they begin their shift, or at the end of the shift. They are monitored for their symptoms. Any symptoms suggestive of COVID, they will be excluded from work until their symptoms resolve. When they are at work, they have to wear a mask, a universal masking policy in all these long-term care homes, even if the home is not in outbreak. So they have to wear that mask all the time. If they are providing care to any person who is suspect or a confirmed case of COVID-19, they have to use the full personal protective equipment to make sure that they are protecting themselves, and then they're properly donning and doffing before they take care of the other person to limit the spread from one person to another. And then, in addition, they have been advised to maintain their physical distancing even with their other colleagues while they're at work, to the best as possible, especially when they're out in a break room, when they're not interacting with patients, but they may be interacting with each other. So all those recommendations are in place to prevent from introducing a COVID-19 case in the long-term care home, and if even someone develops that, they cannot pass it on to someone else. Okay.
Any further questions from CBC?
No, thank you.
Windsor?
Yes, have there been any talks about opening up COVID-19 testing to some of the private labs, like Life Labs or Medical Laboratories in Windsor?
So they are doing the testing, but to the best of my knowledge, these tests, even after collected, it has to go to the public health lab. They have the capacity to do the testing right now, and I'm not sure what time these private labs will actually test it. They can collect the swab, but they'll still have to send it to public health lab.
has there been any discussion on them actually doing the actual testing?
Not to my purview and not my area, so maybe some of this conversation will be happening at some level, but I think not my area that of concern that I can say.
Any further questions from AMA 100? Windsor Star?
No, I'm good, thanks. Not including the ramped-up testing in long-term care, would you still estimate it's between 100 and 150 members of the community being tested each day?
That is the estimation. Right now, we have 2 assessment centers. Just the assessment center at Windsor Regional, we were expecting close to 100 tests a day. Now, with the 2 assessment center, I am anticipating that it would be double the number, but I don't have that data right in front of me. But that's my estimation that at least 200 testings are happening, excluding long-term care home in our region.